During a health disaster such as a pandemic, thousands of people will be infected. How fast the disease spreads will depend on the mode of transmission. Airborne diseases are the hardest to control, because just breathing in the bacteria or virus may cause you to succumb to the disease. Other methods of transmission may be insects such as mosquitoes, malaria, sexual contact, AIDS, and even chemical warfare. Knowing how the disease spreads will allow you to take the correct precautionary measures. If one of your family members gets infected, it can be heartbreaking, but you need to react as quickly as possible. Worrying and second-guessing yourself will not be an option because their life is in your hands. Professional medical care. The first step to take will be to get professional medical help. During health disasters, hospitals will be overflowing with patients and the medical staff will be stretched thin. If there's a vaccine or a treatment, your family member will be given the treatment. If none is available yet, and depending on their condition, the medical staff may give you instructions on how to care for the patient at home. This can be a good thing. Being around other sick people can be a depressing thing. Home care. If you bring the infected family member home, the first thing you'll need to do is isolate them from the rest of the family. Resist the urge to hug the infected person or kiss them on the cheek. Once again, the measures you take will depend on the disease. If the disease is not contagious, you'll not need to be so strict. Unfortunately, most health disasters arise because of contagious diseases. Precautionary steps to take. There are several things you must do when there's an infected person in the house. Firstly, they must be isolated in one room. The room needs to be clean and preferably mopped with a disinfectant. The room should be well ventilated, but the door to the room must be closed. This will air out the room but reduce the risks to the people inside the house. Only one person should treat the patient. Gloves, masks, scrubs, etc. must be used when handling the patient. After safely removing them, discard all these items after use, and if it is safe for you to do so, burn them in your backyard, otherwise they can be bagged then placed in the trash. Wash your hands after handling and do not touch your face or eyes. Do not leave these items lying around the house. Cross-contamination can occur, and the disease can spread within the household. Keep the entire house as clean as possible. Sanitize common areas like doorknobs, doorways, etc. Wipe your food containers with disinfectant and make sure your utensils are sanitized too. Have a bottle of hand sanitizer available so that everyone can keep their hands clean. Avoid touching your face as much as you can. When it comes to treating the patient, follow the doctor's instructions. Give them the medicine they need and ensure that they are fed well and have sufficient water. Always maintain a positive attitude around the patient and keep their spirits up. Crying and giving in to emotions will only cause more distress to the one infected. A positive attitude has its own healing powers. You may place a TV or a radio in their room to entertain them. Keep the volume low so that they can doze off if they're sleepy. Your job as a primary caretaker will be to make them as comfortable as possible. A positive attitude, rest, medication, hydration, time and patience will get them on the way to being healthy again. Health disasters are not pleasant and can inflict a lot of physical, psychological and emotional damage. Be well prepared and stay strong to overcome them. Thanks for watching. Stay safe.